Welcome to SMA's Southern Medicine podcast. Practicing medicine in the southeastern United States presents unique challenges for healthcare professionals. The South's heavily rural population and limited resources require medical professionals to be more resourceful in their approach to providing quality care. SMA's Southern Medicine podcast addresses these issues by drawing on the experience of healthcare leaders who provide a multi-specialty, interdisciplinary team approach to medicine for the purpose of providing better care for the Southern patient population. Today, we are joined by Dr. Veronica Piziak, who will be discussing endocrine disease and COVID-19. Dr. Piziak is Emeritus Director, Division of Endocrinology, and Director of the Diabetes Center for Baylor Scott & White in Temple, Texas. Thank you for joining us today.
Well, thank you, Jennifer, for inviting me. It's a pleasure to be here.
Let's just get started and talk about endocrine disease and COVID-19. I have thyroiditis. Am I more susceptible to contracting the virus?
No, autoimmune thyroid disease does not cause immunocompromise. That's a good question, though, because some autoimmune diseases do result, for example, type 1 diabetes, do result in some immunocompromise and make you more susceptible, but not thyroiditis.
If I take a thyroid replacement, should I change the dose?
No, the American Thyroid Association says that the dose should remain the same. However, you might want to ask your provider if your TSH is in the normal range, if you're on enough thyroid hormone, because patients who are not on enough thyroid hormone and are hypothyroid can have a decreased febrile response, so may not know they have a fever, their white blood cells may not work so well. So you might want to talk to your provider and make sure your TSH is normal.
Does the virus affect the thyroid?
Actually, no. But again, a good question, because some viruses like HIV do affect the thyroid, but this particular one does not seem to affect the thyroid.
Are thyroid cancer patients more susceptible?
The American Thyroid Association says not unless they take chemotherapy that results in immune compromise, and very, very few of our thyroid cancer patients are on immunosuppressive therapy, so no problem there. However, the people who have significant lung metastases are going to have more problems probably if they get a viral disease that causes pneumonia.
Should patients delay surgery or RAI therapy?
No, if you're going to treat your hyperthyroidism, no reason to delay that unless it's exposure to COVID. There are some people who are still not doing surgery that's elective, and there's some nuclear medicine centers that aren't using radioactive iodine temporarily, but there's no reason due to the treatment.
What about those with hyperthyroidism, particularly Graves' disease?
Very important to those folks that we are very careful to protect them from COVID-19 because any significant infection can precipitate thyroid storm. Be sure that if you have hyperthyroidism, you're taking your medication, that your patients are taking their medications, and encourage them to have definitive therapy with surgery or radioactive iodine. Because if this COVID-19 is going to hang around a while, you do not want to be exposed when you have uncontrolled Graves' disease. Methimazole is a mild immunosuppressant, and it should not cause problems unless the dose is more than 15 milligrams. Agranulocytosis and poor reaction to infection is rare with methimazole, but if any of your patients develop a fever or other symptoms, then COVID testing is definitely indicated, particularly if they're on methimazole, and you also need to get a CBC if they're on methimazole.
What about people with diabetes? Especially, I'm particularly interested in this because my mother is diabetic and she is very concerned about COVID-19. So I would be interested in your thoughts about those who do have diabetes.
Well, Unfortunately, uncontrolled diabetes results in dysfunction of the immune system and makes people more susceptible to infections in general. Their white blood cells don't work as well, and they can get more complications from COVID-19. We know that they have more problems, particularly the obese type 2 diabetic has more problems, and ketoacidosis has been noted more commonly in those patients, particularly people of color with COVID-19 and diabetes, particularly uncontrolled diabetes, have a more serious outcome with COVID-19. Also, of course, treatment with dexamethasone, patients who have COVID-19 frequently results in very severe exacerbations of diabetes, and we've seen that in the hospital. So if your physician or if you as a provider are going to treat people with outside the hospital with steroids, you need to be very careful about their diabetes. You need to tell them they probably need to take more bolus insulin, and they may need more basal insulin, but certainly more bolus insulin if you're going to use steroids for treatment outside the hospital.
Are there any key points or final takeaways you would like to share with listeners about endocrine disease and COVID-19?
Well, I would think if, as a person with diabetes, you should definitely try and control your blood sugar as well as possible and watch your food plan. I know that all of my patients are telling me when they're at home, they're eating more because the food is there and they're quarantined and they can't get out to exercise. So very important to do the best you possibly can with your food plan and your exercise program to control your diabetes. This is not the time to run out of insulin. I've had a number of people do that because they couldn't get into an appointment. So look and see if your provider has video visits so they can get your prescriptions renewed. The last thing you want is to run out of your medicines for diabetes. And of course, when you go out, you need to wear an effective mask. It should be over your nose and mouth. And if possible, get a mask that has a couple of layers. You don't want to be out in public with an inadequate mask. And finally, you don't want to be near people. Stay home. Don't go out to the gym. Don't go out to the family reunion. You don't be exposed, I think, is the big key here. Don't be exposed by going out and being in groups. Don't be exposed by not wearing your mask, and take the best possible care of your diabetes.
This has been a really informative conversation, and I appreciate very much your taking some time to share insight regarding endocrine disease and COVID with our listeners. And again, thank you for your time today.
You're welcome, and thank you for inviting me.
Thank you again for joining us. To subscribe to additional SMA podcasts, please visit sma.org/podcasts.